What are the latest ankylosing spondylitis research breakthroughs? Imagine a future where people with ankylosing spondylitis can not only manage their symptoms, but actually slow down or even stop the disease from progressing. That's what current research aims for in 2025. Scientists are making exciting progress beyond just easing pain and stiffness. They are exploring ways to change the disease itself. One of the most promising areas is cell therapy. Researchers are studying mesenchymal stem cells, which are special cells that can reduce inflammation and help repair tissue. These cells can communicate directly with immune cells and releases helpful molecules. They might address the core issues in ankylosing spondylitis that traditional medicines can't fully fix. Another innovative approach is chimeric antigen receptor T cell therapy. This technique involves modifying immune cells to target specific parts of the immune system that cause inflammation. Early results suggest it could lead to long-lasting remission without needing continuous medication. On the drug front, new targeted treatments are gaining approval. JAK inhibitors, such as tofacitinib and upadacitinib, are now available and work by blocking enzymes that promote inflammation. A second-generation JAK1 inhibitor called VC005 is in clinical trials and might be safer by avoiding some side effects linked to JAK2 inhibition. IL-17 inhibitors like secukinumab and ixekizumab, approved about 5 years ago, continue to be refined. A new drug called AC-111 is in advanced testing and blocks two parts of the inflammatory process, IL-17A and IL-17Ra, which could make it more effective. Bimekizumab is another medication showing promise for long-term safety and effectiveness in active axial spondyloarthritis, which includes ankylosing spondylitis. Scientists are also uncovering new clues about the immune system. One discovery involves a gene called ETS that boosts inflammation in certain immune cells. By inhibiting this gene, researchers saw a reduction in inflammation in lab studies. They are also studying macrophages, which are immune cells that can switch between inflammatory and anti-inflammatory states. In late-stage ankylosing spondylitis, there's a shift toward anti-inflammatory macrophages, and understanding this shift could help develop new treatments. Emerging strategies include digital tools like artificial intelligence for better disease tracking and remote monitoring. These technologies can help doctors personalize treatments and catch changes early. Researchers are also exploring how gut health affects inflammation. Microbiome therapies aim to adjust the bacteria in our intestines to reduce disease activity. Combining biologic drugs with physical therapy and mindfulness practices is another approach being tested to help patients achieve longer periods of remission. Russian scientists are working on a new immunotherapy called Sinaprudug. Early reports show it can significantly reduce pain and improve mobility. Some patients have stayed symptom-free for years without traditional drugs. The clinical trial landscape in 2025 is packed with studies on new biologic medicines, personalized treatments, and combination therapies. The goal is not just to control symptoms but to change the course of the disease itself. This shift from simply managing inflammation to trying to modify the disease process is the biggest step forward in treating ankylosing spondylitis. It offers hope that one day, people with this condition might enjoy better quality of life and less joint and spinal damage.